Okay, so let's dive right into this study about steroids and edema in dogs with brain tumors. I got to say, I was particularly interested in the cases where, the clinical improvement didn't really match up with what was happening with the edema volume.
Yeah. It's not always a straightforward correlation, is it?
No, not at all.
It really isn't. I think the study, it kind of highlights how complex that relationship really is. You've got the edema, the steroids, and then the clinical presentation in these cases.
Yeah.
There's definitely more going on than just, looking at the fluid buildup on that MRI.
Right, exactly. And, the study was really focusing on extra-axial tumors, presumed to be meningiomas, but they didn't actually biopsy all the tumors. So that makes you think, how much does that, impact these findings?
That's a good point, yeah. While it's true that most extra-axial tumors are meningiomas, having that histopathological confirmation would have made these findings even stronger.
Right.
It definitely, makes you wonder if the tumor type itself could be playing a role in how they respond to that steroid treatment.
Absolutely. So they compared 2 MRI scans for each dog, one at diagnosis and then another one before radiation. And they really wanted to see if giving those steroids between the scans would actually make a difference in that edema volume. So what did they find?
Well, they did find a statistically significant decrease in edema volume.
Okay.
In the dogs that received steroids.
Okay.
But, and this is really important, the amount of reduction varied, quite a bit. Only 38% of the dogs had what we consider a clinically significant reduction. So that's, over 30% less volume.
That's interesting. So you're saying steroids could be an option, but it's not like a sure thing, right? But what I found really fascinating was that some of those dogs actually got better, even if the edema didn't really improve much.
Right.
Or even it increased.
Yeah.
So what could explain that?
Yeah, that's the burning question, isn't it? If it's not just about reducing that fluid, what other mechanisms are we talking about here? One possibility is that steroids are actually working through other pathways beyond just reducing that vascular permeability.
So what are some of those other pathways then?
Well, we know that steroids have potent anti-inflammatory effects.
Right.
So it's possible that they're reducing that inflammation in the brain, which could then lead to that clinical improvement, even if the edema itself doesn't change all that much.
That makes sense. I mean, inflammation can definitely contribute to those neurological symptoms, right?
Exactly. Another possibility is that those steroids might actually be improving blood flow in the brain.
Okay.
Which could actually alleviate some of those neurological deficits. So even if the fluid volume doesn't change dramatically, just having that better blood flow could still make a clinical difference.
Okay. So we're talking about multiple factors, potentially, that could be contributing to that clinical improvement, not just the edema itself.
Precisely. And I think that brings us back to those 2 cases where those dogs deteriorated despite the steroid use and actually had increased edema.
Yeah.
Those are the cases that are, they're puzzling.
Yeah. What could be happening in those cases?
It's possible that, those tumors were just inherently more aggressive or resistant to that steroid treatment, or maybe those dogs had some underlying medical conditions that made them more susceptible to those negative effects of the steroids.
Okay.
Long-term steroid use can lead to things like immunosuppression, muscle wasting, gastrointestinal issues. So it's possible those side effects were outweighing any potential benefits in those particular cases.
So it's really not a one-size-fits-all situation.
Right.
That decision to use steroids and then how to manage them, that all needs to be individualized.
Absolutely. And I think, this study really highlights the need for careful monitoring of these patients that are on those steroids. You got to pay attention to their neurological status, but also to any potential side effects that might crop up.
I was also really intrigued by the correlation that they found between tumor size and edema.
Yeah.
They noted that dogs with smaller tumors were less likely to actually have edema. So what are your thoughts on that?
Yeah, they found a statistically significant association between smaller tumor volume and the absence of edema. And it suggests that those larger tumors are just more likely to disrupt that blood-brain barrier, triggering that cascade of events that leads to edema formation.
Yeah, a larger tumor, just by its size, it's going to be exerting more pressure for disrupting that surrounding brain tissue.
Right.
And I think that finding has some pretty important implications for, how we approach treatment. Like if you've got a dog with a smaller tumor and there's minimal edema, or maybe even no edema.
Right.
Steroids might not even be necessary. But then for those dogs that have those larger tumors and really significant edema, well, then the steroids could play a much more crucial role.
So again, it comes back to that individualized approach, right?
Tailoring the treatment to each patient and their specific situation. But, stepping back for a second, this study was retrospective.
Right.
And they didn't biopsy every tumor. So how much does that impact what we can actually take away from this?
Yeah, those are definitely important limitations to keep in mind. Because it was retrospective, we can't really definitively say that the steroids caused the edema reduction. It's possible it could be related to other factors that we haven't even considered.
Like what kinds of factors are we talking about?
Well, think about the natural course of the disease.
Right.
Maybe some of those tumors would have regressed on their own, and that would lead to less edema.
Okay.
Or maybe some of the dogs in the study received other treatments, in addition to the steroids.
Right.
That could have impacted that edema, even if those treatments weren't the main focus of the study.
I see what you mean. And then the lack of biopsies for all the tumors adds another layer of, I guess, uncertainty?
Exactly. I mean, we're assuming most of these were meningiomas based on what we saw in the imaging.
Right.
But there's always that chance that some were other types of tumors.
Right.
And, different tumor types could behave differently in terms of that edema formation and their response to steroids.
Right. That makes sense. So it highlights the need for more, I guess, robust studies that are prospective, larger groups.
Yes.
Ideally, histopathological confirmation for all of them.
Absolutely. And I think future research could also help us really understand why some dogs improve clinically, even when you're not seeing a big reduction in that edema.
Yeah.
We talked about a few potential pathways, like those anti-inflammatory effects or, that improved blood flow. But I think we really need more research to really pin down what's going on there.
Right. And those cases where the dogs deteriorated despite the steroids and they actually had increased edema, I mean, those are kind of red flags, aren't they?
They absolutely are. Those are the cases that make you really step back and say, okay, what is going on here?
Well,
is it the tumor itself? Is it driving that progression despite what the steroids are trying to do?
Right.
Are these dogs having some really significant side effects that are outweighing those benefits?
Right.
There are a lot of questions that we still need answers to.
So even though this study points to some potential benefits of using steroids, it also kind of underscores how much we still don't know.
Definitely. But I also think it highlights how crucial it is for veterinarians to really stay up to date on the latest research.
Right.
You really need to understand the nuances of these studies, the limitations, and how those could potentially impact your patients.
Speaking of implications, let's talk about what this means for, the veterinarians and dog owners who are dealing with this diagnosis. What are the key takeaways they should be keeping in mind?
Well, for vets, I think the biggest takeaway is the need for a thoughtful approach to managing edema. It needs to be individualized. We can't just, give steroids and hope for the best. We really have to consider that whole picture, the size and location of the tumor, how bad is that edema, the dog's overall health, and, the potential risks that come with steroid use.
So it's about, carefully weighing those benefits against the possible side effects.
Exactly.
And then making sure you're tailoring that treatment plan accordingly.
Yeah, and you've got to monitor those patients, really closely.
Right.
Looking for those positive responses, but also those negative ones.
So are you seeing neurological improvement? Are the seizures reduced, better mobility, more alertness? But then also, like you said, on the flip side, are you seeing those side effects?
Exactly. You've got to be really observant.
Right. Things like increased thirst or more frequent urination, panting, weight gain, changes in appetite, changes in behavior. I mean, those are all kind of red flags.
Precisely. And I think having that open communication with the owner is so crucial.
Absolutely. So let's shift gears for a second and talk about the owner's perspective.
Okay.
What are the key things that they should be taking away from this, and what questions should they be asking their vet?
Well, I think for owners, this study really emphasizes that while there's hope in managing this edema, it's not a simple problem.
Right.
There's no easy fix.
Right.
Treatment decisions really need to be made on a case-by-case basis. And I think owners should feel empowered to ask those questions.
Right.
How bad is this edema?
Right.
What are we hoping to achieve with the steroids? What are the side effects that we might see? How are we going to keep track of how my dog's doing? Are there other treatment options that we should be thinking about?
So it's really about having that open dialogue with their vet.
Yes.
and making sure they understand the risks and benefits of each treatment option, and then also being observant at home, right?
Absolutely.
Watching their dog for any changes.
You've got it. It's really a team effort, the vet, the owner, and of course, the dog. And I think, despite its limitations, this study offers something really valuable. It's a contribution to that collaborative effort.
I agree. It sheds light on this really complex issue.
Right.
And it gives us a foundation to build on for future research. So to kind of wrap up this deep dive, we've explored this really intricate relationship between peritumoral edema, steroids, and what we see clinically in these dogs with extra-axial brain tumors. And I think, even though steroids show some promise, they're not a simple solution.
No, they're not.
Treatment really needs to be individualized, monitoring is super important, and that open communication between the vet and the owner, that's paramount.
Couldn't have said it better myself. We always encourage our listeners to stay curious, keep learning, and advocate for the best possible care for those furry companions.
Yeah, it sounds like this study really gives us a lot to think about when we're approaching these cases. It's definitely not simple as just, giving steroids and crossing our fingers.
Yeah, you're absolutely right. I mean, there are so many different factors to think about. But I think even with all the limitations, this research still gives us some pretty valuable insights, It gives us a place to start for future studies.
Exactly. And it feels like we're just starting to understand, like how these tumors and the edema and the treatments all kind of interact with each other.
It's a really dynamic field, and there's always more to learn, and that's what makes it so fascinating.
Well said. From Vet Neurojar, keep those minds inspired, hearts light, and tails wagging.